Hello and welcome to the Dr. Shelley Meyer YouTube channel and the Women in Medicine Be the Change podcast. I'm so excited to have Dr. Margo Harrison here, and she's going to tell us a little bit about what she's doing that's completely outside of the traditional OB-GYN that she trained in. And I'm so excited to have you here. Tell us a little bit about your background with OB-GYN, and you were in academia, correct?
Yep.
For a bit. Okay. Tell us a little bit about that. And maybe since we do focus a bit on burnout, maybe what you experienced there as far as that setting, and then what kind of led you in this completely different direction. So just start wherever you want.
Thank you so much for the opportunity to share my story.
Thank you.
I appreciated that you said sort of out of the box, because I feel like from the beginning, I've been a little bit out of the box with medicine. In medical school, I actually took a year off to get a master's in public health. And so I sort of had this concept of wanting to have an impact beyond just sort of the one-on-one doctor-patient relationship. I mean, obviously people impact an incredible amount of people over the course of their career, but really being sort of interested in a public health perspective. So I went into residency with that background, and I trained in New York. And, being able to look back on it now, I think I have full PTSD from residency.
Right.
And so I think the burnout point for me actually happened then. I mean, I was a very motivated and determined person, and I have continued to be that way. But I almost think I've been leaving medicine since the moment I graduated residency.
Wow, that's an interesting concept. I feel like I haven't left medicine, but residency is just so hard. It's just so difficult.
And New York has this whole all these different extra layers of difficulty. And I think I always knew that I wanted to do that public health stuff. So right away from the beginning, I was sort of exploring different ways to provide care. And I started as a laborist at a hospital that was affiliated with Columbia. And I only did the inpatient portion because inpatient labor and delivery is exciting and a lot's happening. So I basically just stopped outpatient care the moment I graduated, only did inpatient. And then in the time I wasn't in the hospital delivering babies, the rest of the time was my own. And I sort of made up my own fellowship. So I was really interested in global health. And we had a very prominent mentor in the Department of OBGYN at Columbia. And so he really mentored me for 3 years. I got to travel with him. I went to Pakistan, which was our sister site, through this national network, and, learned the basics of research from him over the course of 3 years and got a couple of papers, had 10 papers or something that put me in a position where I could go on and pursue an academic career, because I kind of had that baseline. Because in OBGYN, you don't necessarily get the time and the education to really learn about research. So my husband wanted to leave New York. I'm sure I could have stayed there in that position forever, but we actually came out to University of Colorado. We are here in Colorado, and I jumped into what's called a K-12, a career development award. And that's actually a grant that's funded by NIH, and the university gets the grant, and then they hire people into that position. So I had gone from 50% clinical and 50% research to, when I came here, jumping into this position that was 25% clinical and 75% research. And it was a 5-year grant, and it was amazing. I mean, I had a fellowship where I learned basics of health outcomes research. I did a master's certificate in dissemination and implementation science. I went from literally not knowing what research was, having no interest in it really, and, not knowing what a specific aim was, to actually being NIH funded.
Nice.
So I was successful. I got some grants from a couple of different foundations and from NIH. And what happened was I was in this special grant program with a whole committee. And the committee was made up of leaders around campus. And over the course of those 4 years, I basically wrote 50 papers. I mean, I had 10 papers going in, and wow. I have 40 first author papers. And I have a bunch of final author papers. I was starting to mentor people. I developed my own research division within our generalist division of OBGYN. I was the director of research. I also held a director of research position at the Center for Global Health. So I was doing well, right? By all accounts, doing what you're supposed to do in academia. It's pretty clear what you're supposed to do. You're supposed to write papers. You're supposed to write grants. Like, it's not that hard. You're supposed to teach. And so,
well, you say not that hard. I mean, the goal, I mean, it's clear what you're supposed to do, but I think what you were doing was hard, right?
Thank you. Yeah. And I was doing global health research also, which was like kind of an added difficulty there of sort of traveling a lot, but I was loving it. It was going great. My whole committee of people told me to go up for promotion. So I went and looked for a new job and I quit probably a month later.
Well, you found something else that kind of fit into what you wanted to do at that point.
Yeah, well, I didn't really know. I mean, I think for people like thinking about leaving medicine or branching out, it's just incredibly hard. Like we just don't know what else is out there. And
it's such an obstacle that is so hard. People get stuck.
Yeah, I think it's completely overwhelming. So for me, I had always been aiming towards something like the Gates Foundation because I was doing global health research. And so I started looking at jobs there, and the jobs that I wanted that were there were pretty senior, and they wanted like 10 years in pharma or 10 years in device or whatever. So I was like, oh, I guess I have to go to the private sector in order to get where I want to go, in global health. So I started looking at jobs at like pharma and, in device companies. And I even looked at consulting, and because I had all this research training. So I felt like I could really contribute in like the research field, and the jobs I was like, this is not going to be good. Like I have to come at the bottom. I'm like 40 years old. I don't need to be a resident again. I'm not going into consulting.
And you worked so hard to get to where you were. You shouldn't have to start at the bottom. No.
Yeah. I was like, I don't want to be, running the clinical trials in terms of like making sure we enroll enough patients. Like that just doesn't seem like riveting to me.
No.
So I basically, it's kind of funny, like on my first job application, I turned in like an academic medicine resume, which I don't know if you've seen one, but like you're supposed to put on there, like every talk you've ever given, like anything you've ever had there, like 30-page long. So like, trying to apply for like some business job with a 30-page resume. Like, even CEOs have like 1-page resumes. Like, what is this? And I was like, oh, so it was just a really steep learning curve.
A whole different world, right?
Yeah. And I went like a deep dive on LinkedIn. I just was like, and when I saw all the jobs that were out there, I realized there had been this like whole digital health boom that like I didn't even know about. And I was like, wow, look at all these companies. Like they need somebody with a clinical background. I bring the research skills to the table. And because they're sort of early startups, I can be in a leadership role. So like, that was it. After I saw those jobs, I was like, I'm getting one of these. And I just went after those types of positions that I saw on LinkedIn. So pretty much applied for everything through LinkedIn. Had never used LinkedIn before, but for people like who are trying to just explore a little bit, it is like the most powerful tool. I mean, people now with social media, like you can go back to people from forever ago, and you see a company, you type in the name of the company, you see a random person there, and you're just like, hey, remember me? Like I put in my resume. Can you make sure somebody sees it? And like, I think it's just an amazing tool to kind of help you.
Yeah, that's a good pearl out there for people that are looking to change careers. Well, tell us more. No, that's great. That's so inspiring. Tell us what you found, what you're doing now, and how you're being creative with your background.
Yeah. So I because I have a background in women's health and OBGYN, I went after, if you look out there, there's a bunch of different types of digital health companies. So there are startups that are sort of like still in that pharmaceutical space or in the device space, but then a lot of them are in this like digital health space, and they all like are sort of have their niche. So like, no matter what your background is, there's going to be a company out there that's related to your area of expertise. So, there are companies focused on musculoskeletal health. There are companies focused on immunodeficiencies. There are companies focused on women's health. There are companies focused on men's health. Like whatever your background is, it's applicable somewhere. And even if it isn't a perfect match, like your skills are appropriate for those types of positions. So I applied to a bunch of like women's health focused positions, and then also applied to this company that I'm at now called GoGetDoc. And I did get a couple of offers, and it was really, really hard to make the decision. I was like, do I go to a prestigious company, more prestigious like startup that has a big name and is in the OBGYN space, and I can use my research skills and everyone who's there is, comes from McKinsey and like all these amazing backgrounds? Or do I like really push myself and try to get outside women's health and go for more of like a general digital health experience where I can expand my own skills, which ended up being what I was looking for. So I took a position at Go Get Doc, which is basically trying to build a digital first healthcare system. I'm the only clinician on staff. So We're a really early startup, mostly engineers and business people. And then I'm the only clinician there, sort of giving a clinical perspective on all aspects of the business. And then also, like you said, sort of trying to be creative and think about the clinical perspective and how I can really make our products focused on physicians.
And how long have you been with them?
I started in January. So I guess 5 months ago, basically I started January. My last call was January 3rd.
Okay. That must have been a big celebration.
Monday, January 3rd. And then I started my job the next Monday. Wow. So it was kind of a crazy thing, but.
And how does it feel doing this? It's so completely different. Like, is it just using different parts of your brain and like feeling good and like you can get back into some almost like academia in some ways, right? Because, it's a learning curve and you're teaching others. So just tell me how it's going.
It's going well. I think, for physicians, you often know what's expected of you, even if you don't like what's expected of you, or it's not fitting with like who you want to be or where you are in your life. It's not hard to know what someone wants from you. Right. And I think what I've enjoyed most, or what I sort of learned about myself through my research process, was that I really am relatively self-directed, and I prefer to be in a ambiguous situation where I'm making my own path. And I think with an early startup, that's kind of the norm. Everybody's like all hands on deck. Like, you may have an area of focus, but like, no one's telling you like, I need these deliverables by the end of the week. And like, this is your exact job description.
Right. So it's kind of more vague, but you have to be able to fill in those gaps and play different roles, right? Have different.
Exactly. Mm-hmm. I mean, there's almost nothing I love more than like being on a marketing call where we're looking at copy. And like, we're just like, I didn't even know what the word copy was before I started this job. I didn't know what copy meant. I didn't know what product meant. Like, I really just didn't know what these words meant. And so it's been a lot of like learning. And then I think though, as a physician, you are so well trained in like understanding the big picture and then bringing that down to like, what are you going to do for the patient, right? Like you're taking it in, you're sort of understanding the patient's context, who the patient is, like what you think your differential diagnosis is. And you're sort of taking a big picture view and like distilling it down to like, okay, now we're going to do this test. And like, this is going to be your follow-up plan. And I'm going to see you back at this time. And so, I do think the good thing about this type of job is it's a lot of strategy. Like my role is strategy and operations. So someone or my boss might say, my boss is the COO, and he might say like, we need this, like we need a way for patients to do this thing. And I'll be like, okay, like, what is this thing? Like, what do these words mean? Like, how do I even like come up, like understand what the question is for myself to even answer? And then sort of thinking about the approach and then bringing it down to the details, like, okay, we're going to build this product. Like, what is the product actually going to look like? And bringing it down to like, what are the words that you are going to use to convey to the patients or the members or the clients out there, what the big picture is. Like, how do you get from the big picture to the small picture? So I really love it. I also feel like I can just come up with a random thing. Maybe it's a good idea, maybe it's not. But then like 2 months later, I might see it like on a web page. Like maybe some of the ideas didn't go anywhere, but maybe one idea that I came up with, like people were excited about. And now like 2 months later, there it is on the website. And like, I can say like to somebody, like, go check this thing out. It's really cool. And like, that's very rewarding. That really feels like you've built something.
Yeah. Building something is very rewarding. And I think just using the different parts of your brain and being creative And, in our other kind of background with traditional different types of, even in different specialties, we're not using our creative side as much. And it doesn't have to be creative as far as art goes, but like creative as far as coming up with wording and ideas and testing those ideas. And we don't get to do that enough in the day-to-day kind of grind that a lot of docs are in. So
it's so true. I mean, I'm just thinking about a private practice person, you have the world you're functioning in and the way that the healthcare system works, but it's probably not you exactly, but you should be empowered to make it more you. You're speaking to the end user. You are speaking to the end user who's the patient.
Yeah.
Is the patient getting what they need from your practice? Ask them a question at the end of the visit, what could make us more appealing in this way or that way? Do your end user interview and go back to your group. And there's ways to push what you deliver, push the products that you provide, push yourself. Just because somebody else is sort of setting the rules and the boundaries and how things are paid for doesn't mean that if you can still fall within some constraints, you couldn't be more creative or be giving your patients more what they need. And the other part of it is you should also do what you want, right? Just because you're an OBGYN in a general practice or something like that, push yourself to make that job exactly what you want to make it and not let it make you and then make you unhappy,
Yes.
That's that other product one of the products that I'm building for our company is for physicians. And the whole concept behind it is just be the person that you want to be the physician that you want to be on your time, treat the diseases that you want to treat, not the other things that are even within your scope of practice that you don't want to treat, do it on the hours you want to do it, charge what you want to charge for it.
Wow. So, and that's in development. It's not a product we can view yet, but it's in development.
Actually, we can view it. So just about the company. So Go Get Doc is basically, like I said, we're trying to build a digital first healthcare system. So when you think of a healthcare system, you think of the doctors and then you also think of the patients. So we're bringing doctors and patients together. And when we think of patients, we want to serve every single stakeholder. So a patient might be an individual, it might be a family, it might be a company, it might be a state, it might be a union, any type of consumer can come to the site. And we will supply them with some basic primary care and hopefully eventually expand those services. But on the delivery side, we also want the individual, the clinic, the hospital system, the digital health company. So we have built our company in a way that we can accommodate anyone on the consuming side, and we can accommodate anyone on the delivery side. Okay. And so when it comes to the individual, so when it comes to a doctor like myself, and I'm talking to people right now about it. If you want me to share my screen, I can show you. Sure. If you're interested. Mm-hmm. I can show you kind of what so this is our platform. So basically a doctor can just jump on our platform. We're going to check your licensure, make sure that you're only providing care for patients that you're in the state where you can provide legally care to people. So there's a whole intake process to make sure that you're providing appropriately and that people aren't seeing you who can't get your care. So only people in the states where you provide care would see you. But This is our product that a physician could just jump into. And this is ready to go, but it's our first product, which means that if you joined us or you joined the platform, you could help us build out the next iterations. You will be the clinicians practicing on the platform. So you will tell me you need this, this is not working. I would love if I could do this. But basically, this is the whole EMR. You basically join the visit, you get a link and you can join the visit and you can design your own intake. So you can see here, patient information and, the intake that the patient provides would say why are they coming? What are their medical conditions? What are they allergic to? What medications are they on? You would design the actual chat questions that you ask the patient. So you could have a protocol, if you were an OBGYN, you could have a birth control protocol, or you could have stress incontinence protocol, or you could have sexual assault protocol, like whatever is the thing. Like, when I used to teach research, I used to ask people to close their eyes and think about what made them most happy in their job that week. And I would try to turn that into a research project so that they would actually feel passionate about the research they were doing. And you could do the same thing here. You could close your eyes and be like, when it comes down to it, I like literally love my little old ladies and their pessary fittings because I feel like I'm like doing them a service. So you could think of like what makes you, and I think that's a way to get at your point of like getting through burnout. It's like, well, you're doing a lot of things that are not making you happy just to do the things that are making you happy. And the balance is not working for you. There's more of the unhappy things than the happy things. And this really is an opportunity to do the happy things and do them on the amount that you want to do them on. So our site really allows you to kind of upload your schedule, choose the times that you would want to do. So you could even keep your current job and just do a couple of visits in the afternoon or the evening when you got home. We offer synchronous and then async chat, like texting.
Oh, wow. Okay.
So let's say that you are the like only person in the country who's a specialist in some kind of very specific GYN cancer. But so you want to charge a lot of money for your synchronous visits. This is all cash pay through our service right now. You can send for reimbursement from your insurance company, but right now we're just doing cash. So you could say like, okay, I'm gonna charge like, $250 for like a 45-minute meeting or whatever you want to charge, whatever you think you're worth. But you might say like, I also care about people and I want people to be able to access me. Mm-hmm. So I'm going to offer a chat service that's at a cheaper cost. Okay. So, you can chat with me about your issue and I can tell you need to see me in the visit, or someone could chat you at a lower price point and request a discount or something like that. So there's both synchronous and asynchronous. Let me see if I can switch to the asynchronous. So this is kind of the chat, but it looks exactly the same, but you can sort of chat back and forth. You could make your own protocols again. You can write your medical notes. We have prescription, the ability to prescribe. We have the ability to diagnose. We have the ability to write, patient notes. So we're building out the functionalities that people need to run a practice. And that's it. It's like, you don't work for us. If you decided you wanted to do this, you're your own employer. You're just paying to use this platform. And we have so many people on the platform already that we would be able to market to who you wanted to, reach. So if you're in California, you only have a California state license, you would just market to people in California that you're legally able to see. And so we would help you get those eyes on your clinic or on your protocols, and then people would opt in. So, we're
using our own malpractice, obviously, that we have for that state.
Well, I don't know that people's like, yes, it's worth looking into your current malpractice. It depends also on what your contract is. Like if your company's contract says you can't work for anybody else, then you need to figure out like what's legal under your contract. I do have some doctors who are like forming an LLC so that like the payment that comes to them can go into the LLC. And that way the LLC can protect some of the funds because they may be at an institution where the institution, like once they hit a certain amount of money, it's going to take a percentage. So there's some nuances there.
Of course. Yeah. There always will be.
But basically, malpractice. So we'll be getting, since it's just digital, I mean, you could have somebody come into your clinic. Like if you only, marketed to people in California and you like were talking to little old ladies about their pessaries, but you needed to actually fit them or have them see somebody and you wanted to bring them into your practice. Obviously, when they come into your practice, you're covered on malpractice and you can take their insurance, but maybe the initial consultation doesn't take insurance. And we would offer a digital health malpractice coverage.
Oh, okay.
Yeah. And it would be part of like the monthly cost. And it's not crazy because like you literally can't do anything to the patient. Right. It's just information based. And of course, there are consents that they have to sign and acknowledge that this is digital healthcare. And like, you can even put your own copy on that would say like, this is what I'm providing you. This is what I'm not providing you. And sort of like, do all the things that we have to do to protect ourselves.
And do you have any templates for that? Like if somebody's joining you and a practitioner hasn't done this before, any kind of guidance there on how to set up that?
Well, we would help you set that up.
Oh, okay. Gotcha.
Yep. So that's one of our products is just a little more bare bones. It's like actually just having if you were somebody who is actually just providing coaching or something, you don't actually like call it medical care, and you didn't actually need like a malpractice coverage, you could just use the basic coaching platform, if you will.
Okay.
If you needed malpractice and you wanted to call what you were doing medical care, you would opt into a different package where we would help you with that.
Awesome.
And like with that more expensive package would also come like additional licensure. Because if you were like, look, I am the only person in the country who does this like very rare GYN cancer, so I'm just going to leave all these things and I want to be the person in the country who does this. In order to do that and be providing medical care, you would need to be licensed in a number of different places. So we would also help you get additional licensure.
Wow. I think this will be really interesting for a lot of people watching and listening. It was much more like I would look at your site, but I didn't know there was all this opportunity for us as on the provider side. So definitely let us know. How can we look into this more? How can we get in touch?
Well, I would love for you guys to contact me. I would love to talk to you about what you're trying to accomplish, and how I can help you get there. Obviously,
what's the best way to do that?
Just, you can email me.
Okay.
Margo, Margo, at gogetdoc.com. So gogetdoc.com.
Okay.
Yeah, I would love to hear from people. We're starting to onboard. We have about 10 providers right now we have companies on the platform, and we have a marketplace. So like if you were seeing patients and you're a primary care provider and you're providing certain protocols, but you diagnose somebody with an autoimmune disease and you want them to get additional care, we have like a full marketplace full of those digital health providers. So you would be able to forward them on to a digital health company that does that type of specific care. Or you could just, refer them to somebody in your state or in your community if you felt more comfortable with that. Or you can refer them through ZocDoc, who's one of our partners, like if you felt like they needed additional specialty care. But
cool.
Yeah, contact me.
Okay.
We have companies on, we have doctors who are working on building out their protocols right now. I can help you build out your protocols and talk to you a little bit more about the details of like what it would actually look like. But the more the merrier. We love to have people on. And I think like, not only is it an opportunity for you to do what you want, it's also an opportunity for you to start your own brand. Like, what do I want to be known for? Like, I don't want to just be an OBGYN. I want to be the person who does postpartum depression, for patients. Like I want that whole context of care, their physical care and their mental health care. So like, you can put yourself on the site as like a specialist in your area of interest. Like, this is the type of care that I deliver, and these are my protocols within that, scope of care. So.
Well, cool. Yeah. I'm going to include your information in the show notes and the description so docs can reach out to you, because this sounds really interesting and exciting and something that somebody can start small with and kind of dip their toes in and
absolutely,
then, get comfortable with.
Yes.
It's a shift.
Yeah. You can just the first month's free, like when we get to like roll people on. So you could do it for a month. Do some async chats or just do a general visit. You wouldn't even need to do a protocol. You could just do a general visit and sort of see how a patient's coming in, like what your price point is. Like if you offer something different, can you put a higher price on there?
Right.
So you would just pay us a subscription to use the platform, but otherwise you're on your own, basically. Like we'll help you with the malpractice and things like that, but we're not your boss. You'll never get in trouble. We're not telling you have to see 50 patients a day. We're literally telling you can see 0 patients this month, or you can see 500. That is your decision. This is your life.
Yeah. Oh, I love that. That's a great place to end. So thank you so much for joining me.
Thank you.
I think a lot of people will be excited about this. So we're going to have your contact information. And thanks for spending so much time with us today and explaining this whole thing. And I think it's wonderful what you're doing and what your company's doing. And the fact that you could recognize you didn't belong where you were before and just kind of venture out into something completely different. I think that's really inspirational too. So thanks for sharing that.
Thanks for letting me, unburden myself, a little therapy here, and then the opportunity to share what I'm up to. I'm really grateful.
That's the mission here. So thanks so much.